Hello, we will discuss the cast, partial veneer, crown, inlay and onlay preparations. Partial veneer crowns, they include all the tooth surfaces except the buccal or the labial wall in the preparation. Because their preparation is more demanding, they are not routinely provided by the practitioners and not provided clinically in the daily basis. The partial veneer crowns can be posterior and they are include the 3/4 modified 3/4 7/8 crowns. For the anterior teeth, we have the 3/4 crowns and the pillages. They are primarily used when we have a moderate amount of tooth structure that is lost. Also, they are contradicted when we have short clinical crowns and when we have an endodontically treated teeth, because we have an insufficient tooth structure that is remained after the endo treatment. But if it was done in the right way, it can last for more than 35 years. We see these restorations. These are the type of the 3/4 crown. This is the modified 3/4 crown. This is the 7/8 crown. And this is the pillage on a canine and on a incisor, central incisor. There are disadvantages that they are less retentive and less resistive than the complete cast crowns, and their preparation is more challenging, so they need a professional operator to get the grooves, boxes and the pinholes with the right dimensions and angles that we will discuss in details soon. We will start by knowing the preparation of a 3/4 maxillary premolar. We start the preparation by doing an initial depth holes of 0.8 millimeter deep in the mesial and the distal fossa. Then we connect them and extend them through the central groove. We do an additional guiding groove. By connecting these grooves together, we finish the occlusal reduction and which is the preparation. Then we do start with the proximal side. We do also a guiding grooves in the lingual surface of the tooth that is parallel to the proposed path of the placement. Then we complete it doing a chamfer margin like this in F. The reduction is done half by half, so with that we have a reference for the appropriate thickness to maintain the conservativity of the preparation. Now for the challenging and the important part are the proximal grooves, these that are placed perpendicular to the prepared surface, and this angle is flared up. This here we flare it up in this direction to leave no unsupported enamel. We round the line angles and the preparation is finished. We can anticipate the location of the preparation, marking it with a sterilized pen. There is a common error that insufficient reduction of the tooth structure in the buccolingual central of the marginal ridge area here, which means in this place here. We must remove it here. In this area must be removed. Also the occlusal reduction to get a clearance of 1 1 millimeter for the non-functional cusps and 1.5 millimeter for the functional cusps. Here they are discussing the preparation of the groove is that we place the burr perpendicular to the prepared surface, and after we do the buccal wall of the proximal groove, we do what is called a flare in and out direction to remove any unsupported enamel. Concept is important when we are preparing the distal proximal reduction, where we have an adjacent teeth to the prepared one. We stop the preparation and we do not continue to break the contact. What we do the groove placement that we mentioned before. With the subsequent flaring, when we do both, we get the interproximal clearing results. So this is important step to keep in mind. For the geometry of this groove, it is tapered. It is deeper near the occlusal table, and the floor of it is a chamfer, and it should be flat and smooth. Also, we can do a bevel to this chamfer of the groove with a height of 4 millimeters. We put the tungsten carbide burr oriented parallel. Now for the modified 3/4 crown, is we incorporate the bucco-occlusal contra bevel. This bevel should remain within the curvature of the cusp tip and should not extend to the buccal wall. It will result in a convex shape of the restoration, and light is prevented from reflecting back to the observer. So, in the result, we get a less obvious and the outline form of the remaining buccal enamel is perceived as the shape of the tooth. We use a diamond burr with the angulation in this side, and we place the bevel in this area. We have this case of a branch that used one of the retainers was a 3/4 modified preparation, and the molar was a complete crown. We will see the tricks of it. Here, the premolar had a distal groove that is positioned close to the buccolingual center of the tooth. We see that they did an extension of the preparation into the buccal surface of the tooth here to compensate for the short clinical crowns of the molar, the mandibular molar, in comparison with the maxillary molars. Also, it has a width, it's not thin. We see it here from the lateral view, and this is from the occlusal view. We see that there is a considerable thickness of gold that protects the buccal cusp, and this is the final bridge. Now for the pin lens that is used in the anterior areas, it is only a preparation of the palatal wall of the tooth to do a bridge that restore a missing tooth. It is prepared with a depth using these depth hole. These are of 2 millimeters, and we can use uh, proximal grooves. These are in the mesial and the distal side. These are to increase the retention and to make the path of the insertion unified. This is it here. The pin length restoration can be used as a fixed splint for a compromised periodontally caries-free teeth with an adequate buccolingual width. They did a retention of the intact label enamel of all the 6 anterior teeth. Now for the inlays and onlays. The MOD inlays increases the risk of cusp fracture, and they are generally not recommended. As for the onlays that support the cusp, they reduce the risk of the tooth fracture. This is an example of posterior restored with a cast gold inlays. How they are prepared. We start up with an MOD class 2 preparation. We do the boxes on the proximal surfaces. They should extend just beyond the proximal contact area. Then we do the depth groove on the occlusal surface to start the reduction of 0.8 on the non-functional cusp and 1.3 on the functional cusp. Then we do the bevel of the on the buccal shoulder. We continue the bevel that makes a smooth transition into the proximal boxes. This is the preparation also. We first define the outline, then we do the proximal boxes to remove the contacts, and we remove the unsupported enamel with hand instruments. The proximal boxes are extended to form a 90 degrees surface. Then we do the occlusal reduction. We do the bevel, and the preparation is complete. This is an onlays that used to provide cuspal protection of the second molar. That's it.